And thank you, Pam, and thank you everyone from KHA who's here, who really helped us put this together. So this was a conversation that we've been wanting to have for a couple of weeks now. I know there was not a whole lot of advance notice with this, but we kind of had to jump on pockets of time where we could. So glad you all are with us. My name is Brent Pacanowski. I'm the System Director of Supply Chain Logistics and Analytics for Norton Healthcare in Louisville. I'm also the current president of KSHPM. KSHPM stands for the Kentucky Society of Healthcare Purchasing and Materials Managers. We're the local chapter of ARM, and we also work closely with the Kentucky Hospital Association. We normally meet once or twice a year in person, and we also conduct conference calls throughout the year. Thanks to Zoom technology, I think we'll probably start doing more of this. Our mission is pretty simple. We just want to provide a platform for Kentucky healthcare supply chain professionals to exchange ideas, best practices, and also to offer continuing education and continuing credit opportunities. So this year has been a year unlike any other. I'm not telling anybody anything they don't know here. And really the past several KSHPM calls that we've had have focused around COVID-19. So if you find value in this call and you want to learn more about our group, please email me. It's brent.pacanowski@nortonhealthcare.org. My name's up there, so if you just copy that down and just put a dot between the T and the P, that'd be great. I'll be happy to tell you more about KSHPM. I think we always offer value to our members, but especially at this point in history, I would encourage all healthcare supply chain leaders across the Commonwealth to stay engaged with their peers. We all always learn from each other, and especially now at this point in time, I think there's so much benefit to us staying connected. Speaking of learning from each other, I wanted to kind of segue into my shameless plug here while I've got everybody for our fall conference. KSHPM will once again be joining our friends in the Engineering, Safety, and Infection Prevention Societies at the Kentucky Healthcare Coalition Conference. It's a two-day conference held in Owensboro this year on September 30th and October 1st, assuming that we're allowed to have it. We are preparing an agenda that you will not want to miss. Supply chain track will center around a COVID-19 theme with pandemic lessons learned, where we are, where we're going, and what we should be preparing for now, especially if there's, unfortunately, if there's an anticipated surge later this year or this winter. I think that conference is going to set us up very well by hearing from experts, by sharing things that we've learned, maybe raising the bar from some of our vendors and our distributors, quite frankly, and going from there. So to me, this conference this year has a real opportunity to do what I think KSHPM was always designed to do, and that is to really work as a community and to take care of each other, take care of this state. And I think that there's a real need for that, and I think there's a real desire for that right now. The way things change daily, it just makes sense to me that we have a group like this and then we're able to get together, assuming we're able to get together. So if we're not able to get together, we are still going to have a conference, but we'll just do some sort of virtual presentations or something. You're still going to want to be part of that. I promise you that it'll bring a lot of value. Right now, we're still finalizing the speakers and the topics, and Janelle's working hard on this, and we're working with Pam and trying to put together the best agenda possible. But again, the vision is that we have top speakers giving relevant presentations, as well as guest panel discussions with experts from emergency preparedness, supply chain, infection prevention, predictive modeling, and also state officials. So we're really going to raise our game on this one. We're really going to make this one everything that we feel like it needs to be at this point in time. So I honestly, given the theme and the material, this really might be the most important conference we've ever had as a society. So not to be dramatic, but that's just the way I feel about it. So any questions from anybody about the conference or about KSHPM that I can answer? I see Carrie Scordo out there. Carrie, thank you for taking on some additional responsibilities this week. You're awesome. She's muted, but I can read her lips. She's saying, Brent, you're awesome too. Great. Thank you, Carrie. Appreciate that. Okay. So with that, I'm going to turn it over to Ashley Peterson. Ashley is with Member Services at KHA and is going to give us an overview of KHA's PPE Exchange program. So I'm excited to hear about this. So Ashley, I'm going to put myself on mute.
Sure, thanks Brent. Nice to meet you all. I see a couple names out there that I recognize, and even two that are already signed up previously on our PPE Exchange platform. This uses the website Mobilize. It also works fairly well as an app on your phone. I started using this through the American Hospital Association for our membership platform, those who also do membership engagement in other states. So, you know, the only downside here, of course, another username and password you have to remember, but this makes it a secure platform for you and your peers to have discussions, share best practices, and also share information, materials. Our president, Nancy Galvani, once we decided that there would need to be 14 days of PPE on hand to resume elective procedures, she wanted to make sure our hospitals had a reliable way to, you know, make sure that they had the supplies they needed. And this will allow you to reach out to those in your area if, you know, you run up on a shortage and you want to get your hands on good materials. So I'm going to share my screen and run through this quickly. And we have our disclaimer here that we're just offering this to KHA members, and there won't be any outside entities in here. You do fill out a form and apply for membership, and then I have to click a button to accept you. And here on the screen, I will show you we already have a chief medical officer forum up and running that we started during the COVID pandemic as well. So we post documents. Our staff keeps an eye on this as a way to how we can help our members, and you can, you know, pose questions to us, pose questions to the group, say, you know, what's going on with booties? You know, that was one that came up in the past couple of weeks that was kind of unexpected. You can, you know, use this to literally share materials, or KHA can reach out and look for vetted partners. There's a variety of different ways that this works. It looks similar to other social media. It's pretty self-explanatory. I know a lot of people have jumped on here and gotten the hang of it very quickly. You can see who else is in the group. You know, much like this, you get to see, put a face with a name if you'd like, and reach out to somebody privately. You don't have to post for the entire group. You can send a message just to someone you're trying to get in contact with. And there is a shared resources page, files, where KHA staff will put things that we want to share with your specific group, or you can send us files or upload files to share with your peers as well. And when you click the link, you'll just need to do your first name, last name, email, your hospital, and your job title. That will send me an email and I'll accept you, and that will allow you to start joining the group. And just the one thing I offer is, you know, platforms like this are only good tools if everybody engages and uses them. So the more people we can invite and the better discussions we can have going, the better. Does anybody have any questions?
Ashley, that's great. We need to update our KSHPMM website. Would you mind if we put a link on our website to that page also?
Sure. I can send you this PowerPoint for anybody that needs instructions, and I'll send you the link separately that you can share with any hospital. And I don't think I mentioned in there, but more than one individual from each hospital can join. It's not just, you know, a username for your hospital. You can have a lab director and a purchasing person, whoever you'd like in there.
That's awesome. Thank you, Ashley. Are there any questions from anyone about this program, or about the PPE Exchange in general for Ashley?
Everybody has had a pretty easy time getting started, but you know, if you're not receiving the emails or notifications or something when you sign up, please feel free to contact me. My email is on the slide that I will share again with the group, and I'll be happy to help anybody that needs it.
Thanks so much. We really appreciate that, Ashley.
Thank you.
Okay, so right now testing is the key to everything, right? And we're really, really pleased to have so many lab directors join our call today. I think this next conversation is going to be of particular interest to you. Nibert is here with Mako Medical, and Ryan, if you want to just jump right in, introduce yourself, introduce the program, and take her away. I would like to hopefully have a few minutes at the end of this for any kind of open discussion, but I also don't want to limit you on what the information you're sharing with the group. So having said that, I'm going to put myself on mute and learn something from you.
Sure, certainly, and I appreciate you all listening in today. My name is Ryan Nibert. I'm a partner with Mako Medical. We're a full-service laboratory that essentially started in West Virginia, but we did have to move it to North Carolina because of the lack of vendors. So I would like to speak on mainly just COVID-19 testing and what we're doing differently, why we're special, what our partnership with KHA means to all of you. So I'm going to go ahead and share my screen with you. And we will kind of, I'll give you a quick little pitch about Mako Medical. So essentially, we have essentially worked a deal with KHA, essentially to carve out essentially a portion of our laboratory just for Kentucky hospitals. So right now, you're seeing so many nursing homes, assisted living facilities, hospitals that need to take advantage of a certain amount of capacity with the laboratories that they're working with. There's so many struggles right now with access to kits, access to results, when they need help. Is there a scientist that can actually be able to talk them through why this needs recollected, why this patient came back inconsistent, why they're seeing this, and so forth. And Mako is essentially coming across with a white glove approach. So we're in a position right now where we have carved out 5,000 specimens per day, 7 days a week, just for Kentucky hospitals. So this is the advantages with Mako. We of course have a level of commitment right now to Kentucky that we're very interested in working with many hospitals. We've as of right now, I think signed up 4 or 5 hospitals in Kentucky that are utilizing our services. So I'll just kind of run through some of these points. So with Mako, you have access to kits found nowhere else. So essentially right now we have about 500,000 kits on hand in our laboratory. We have 10 to 12 vendors that we are utilizing to constantly keep those stocked weekly, daily. We're getting shipments sometimes 3 to 4 times a week. Dedicated Mako team members in the lab and boots on the ground. So Jonathan Tucker and I, and actually we had an outbreak here in West Virginia, so he actually had to go on site and help with some testing, or he would have been on the call as well. We are dedicated to Kentucky. We are in the hospitals. We're boots on the ground. If you have questions, you can contact us directly. We have basically worked with KHA to say, hey, we're going to handle this. They can contact just us. They don't have to call 1-800 number. They don't have to call our lab if they have questions about results. If they need more kits, they can just text me, call me. We can get them more kits. We're making things really easy. We're cutting through red tape and getting you all access to laboratory results, kits, and access to us that you need. And that kind of touches on the next point there, direct line of communication with the executive. So, you know, we want to cut through a lot of the red tape that's happening right now. Our fast turnaround time to help your communities get back to normal. So once it's received in the laboratory, which, you know, we have a courier system in some parts of Kentucky. For others that we don't, we are FedExing overnight. It typically will get there about, you know, anywhere from 5 to 6 hours later than if it was actually driven. But we are seeing 36 hours or less once it's received in the laboratory. And I know there's a lot of labs out there that are doing a pretty good job, but there's also a lot of labs out there that aren't doing that good of a job on turnaround time. And for your pre-op and pre-procedure, it doesn't help you if you get your results back in 4 or 5 business days. So right now we're having a very fast turnaround time with Mako Medical, and we're very proud about what we're doing. So the extraordinary circumstances of the pandemic requires hospitals to look outside the lab service partners that they've grown familiar with. So, you know, all of us in this business that we know how relationships work. You've had great relationships, some of you with some of the big top tier laboratories, or maybe even the smaller companies in Kentucky. But right now, it's really not about that. It's about having options. if you were to have an outbreak at one of your local nursing homes and you need 5,000 kits next week, or is your lab partner going to be able to get those for you? So that is what we're basically saying that we're able to do for you at a moment's notice. I'm getting calls from all over the country from states that need help, and we're trying to help them and lend a hand. And that's why we are pushing so hard for this partnership, because we've carved out 5,000 a day just for Kentucky. And of course, that number can go up based on demand. But what we're trying to do is say, hey, at least you have a backup plan, and there's options if your current laboratory cannot meet that. Because we're seeing, I just saw today, you know, there's a local outbreak at the 911 center. There's got to be 200 people tested right now. They're moving the entire 911 center in Kanawha County to another location. Every single person at that center has to be tested. Can your laboratory and can your hospital handle that if there's an outbreak? So our goal with Mako right now is to help patients get out of the hospital faster. So with a faster turnaround time, you're able to identify if that person's positive or negative. You know, we got individuals in hospice, not really sure what to do with them. Do you send them to the hospital? Do you have to quarantine them there for 14 days? Because we can't keep them in hospice. Same with nursing home individuals. If you're waiting an extra 2 or 3 days, what is the cost to your hospital to house that patient for an extra 2 or 3 days? So our streamlined ordering process also makes it very seamless for the laboratory and providers and staff that are utilizing. We have a web-based portal where you can actually view results. We just give a username and password. We have paper rec forms where essentially you can just you know, fill those out as well. And we've made it very easy where it's just the DX codes and you select for the SARS-CoV-2 test. So our level of commitment, I think right now with KHA is certainly there. For some of you calling in that can't see this on my screen, essentially this is kind of just our quick little flyer. Around the clock positive test notifications. We are calling people at all hours of the day and night. Some people typically, they don't want that, but right now that's what it requires. So I do have doctors, I was sending emails at 3 a.m. last night. I do have doctors reaching out. They want to know their patient results. A couple hours sometimes can mean life or death right now. So we're working 24/7 in our lab, calling criticals, running specimens. We have a dedicated team that we have set aside and a dedicated instrument only for Kentucky hospitals. I don't think that there's a lot of laboratories that have presented that to you all. We are basically saying that when your specimens show up to Mako Medical, there's a Kentucky team that are going to run your specimens. If you have questions, we're going to be able to handle. You're going to be able to have one direct line of communication, and there's an instrument set aside. It's not one of those things where, well, you know, these specimens showed up before you from this date, so you have to wait a couple extra days. It's not going to work like that for you. So, of course, the amount of swabs that we're utilizing, we currently right now have 9 12K PCR instruments. Some of you may know what that is or may not know what that is, but that is a Thermo Fisher instrument. A lot of our competitors are using the 7K, so we are using the 12K. So with the 12K, you're able to do about 32-fold more than the 7K. So when a lot of people are asking us essentially, why are you able to get the results so much faster? Well, that's one of the reasons. It's our platform. It's our access to kits, our platform, and our PCR instruments that we're utilizing. They're able to run so much more per batch. And of course, our instruments are validated for nasal as well as throat collection. So the swabs that we are utilizing can be used for both. The accuracy is exactly the same. We get a lot of questions, well, why don't we just do throat collection every time then? Well, you can do that, but the problem with it, the nasal is certainly the gold standard. You know, anyone would tell you that that's utilizing PCR instrumentation, because with the throat collection, you don't always get a good collection. So it leads to a little bit more recollection. So the next slide that I have here is basically just, you know, representing how Mako has reserved 5,000 COVID-19 RT PCR tests per day for Kentucky. So we have carved out like a section of our laboratory just for Kentucky hospitals. We want to go to work for you. We want to assist in any way that we can. You know, we're doing a client bill situation with the hospital, so there's a way for you all to actually collect revenue, make that extra margin. You guys bill it out to insurance companies. You collect that margin, whatever that may be. And it's also a chance for you to reach out to your local community, work with local businesses, work with your nursing homes, assisted living facilities. Your providers, your staff go out and do the swabs, and it seems as if the hospital is the one running the test, but it's actually Mako running the test. So that's another way that you can branch out, because I'm sure with many of your labs, if you were to all of a sudden ramp up 1,000 a day, could they really take care of you with that? So that's what we're presenting to you right now at Mako, is that reach out to your local communities, reach out to your businesses. There's a way to make margin there on the test. We want to get back to up and running. We want to get the communities back to work, and that's certainly a way that you can do it with Mako Medical. So my next slide here, basically just the COVID crisis is not about testing capacity, but it's about combining capacity with coordination. So, you know, like I said before, we have logistics, we have plenty of swabs, we have the instruments to be able to run it, we have the staff. We just hired about additional 150 staff members at Mako Medical to only run COVID-19 specimens. So we have really ramped up to be able to assist multiple states, and we want to certainly help Kentucky. Jonathan and I live in West Virginia, and we currently do some work in Kentucky already, in Eastern Kentucky, and our goal is to create long-term partnerships. Our goal is not just to come to Kentucky and help you with COVID. Our goal is to come in and help you with all of your lab services. We do everything like your big box store laboratories, like LabCorp and Quest. We're a full-service lab. We're just privately held, so we're able to actually go out and tailor things to what you all want and what the doctors want. And I'll open it up to questions if there are any. I thank you all for listening to me today. I know it's a quick pitch, and I've been running on barely any sleep and lots of caffeine recently, so sorry if I'm talking a million miles a minute, but it's certainly a pandemic. So if there's any questions, I would love to open it up and see if I can answer any of them.
All right, this is Alan Kopic. If any of you have questions, you can either put those in the chat box and I'll ask the question if you prefer that, or you can unmute yourself and then speak live to Ryan. And then Brent, this is your meeting, your agenda, so I'll turn it back to you and let you handle the questions if you like. But that's just logistically how to do it.
Either way, to me, you know, if I hate to have anybody talk over each other, so if we have a situation like that, just please be aware that if someone else is speaking, to just wait in line, or use the, I don't know how to use the raise your hand thing, Alan, but I know it's out there. Pam, while we're waiting for questions, anything to add about the relationship between Mako and KHA from your perspective?
Yeah, thank you, Brent, for asking, and thank you, KSHPMM, for allowing Mako to share with you all their expertise. We have found them to just be a wonderful partner. A couple weeks ago, when the testing was really kind of ramping up, and we knew that we were not getting the access or the turnaround that we needed to get into phase 2 of our phase 4 rollout, we started looking, almost panicking, and looking for a full service reference lab. And Mako, I kind of say it was like manna from heaven. Started working with their founder, who has been completely hands-on, Ryan Nibert, Jonathan Tucker. They would be, like Ryan said, your boots on the ground, white glove approach, so that you don't have to get into an 800 number if you're looking for results for a specific test. You can call them direct. You have their cell. So they have just been wonderful. I did quite a bit of vetting on them, from calling other hospital CEOs around the country that use Mako. And I would always leave it with, okay, on a scale of 1 to 10, how would you rate Mako? And I always got a 10. So I just love that we've got this partner and we've got this reserve capacity in the state. I think it's really important for our hospitals to focus on being the hub to help our communities open up. We really need to understand that the CARES Act relief money will run out when it comes to this free testing that we're getting. Although that's been great, we need to focus on how we can be the hub, and even consider this as a reimbursement service line for our hospitals to make some of that money by working with the employers in your market, the nursing homes, the pharmacies, the rural health clinics, the federally qualified health clinics, dental offices. There's so much opportunity for you all to be that hub and to be able to capture that reimbursement dollar. This is a CPT U0003. Medicare reimburses $100 on this. Mako is doing an all-in charge per kit of $85. That includes the logistics, everything. So there is quite a bit of spread. And with some of the insurance companies, you can make well over $100 of what the Medicare fee rate is. So thank you for allowing us to be part of this discussion.
Thanks, Pam. Are there any questions, comments, feedback from anyone? Again, I know we've got a mixture of laboratory professionals and supply chain professionals. Any thoughts out there at all? Any concerns or additional thoughts?
It's Mike. I have a question. So, Mako, are you mostly just in Kentucky, or are you outside Kentucky as well?
So we, with COVID, honestly, we've been helping about 16 to 20 states with a little bit of testing. Overall, our headquarters is in North Carolina. Jonathan and I were around kind of the initial start of the business with Mako when it started in West Virginia, then it moved to North Carolina. So overall, our typical footprint is about 7 states, but we do a little bit in a lot of different states. Our goal at Mako is to always grow at an appropriate pace. So actually last year we were named the fastest growing laboratory in America. The reason that we're able to accomplish that is because we take a different approach. What all the other big box store laboratories are doing, like LabCorp and Quest, we do the opposite of them. The things that you don't like from them, that's what we do right. That's our goal, is to essentially come in and take another glance at the laboratory experience and change it and be able to assist you in many different ways that they're not able to. Bring you ideas and innovation that it might not always help our bottom line, but it creates a partnership that's going to last forever. Because if somebody helps you make money, you're going to remember them and work with them a very long time. And those are the things that we bring to the table at Mako Medical. It's the innovation, being in the research triangle, bringing the talent from UNC, Duke, LabCorp is, 25 minutes from them. So a lot of their scientists come to Mako and make 40% less. Why would they do that? Well, they want to be a part of the team that makes a difference. And right now at Mako, we strive on making a difference. We're a faith-based company. We hire only military veterans for our logistics. So we go a lot further than just saying, hey, we're a lab. If you need, blood work done, we can help you. We're doing a lot more in the community and a lot more for our facilities that we work with.
Do you just do the lab things, or can you, for example, if I have a facility that has a set feed machine, but I can't get the reagents to run the PCRs?
On any other day besides COVID, we are more than willing to help you source and help you get reagents at our pricing. So we're able to of course, source it at, we're doing about, 7-8 million right now a month of just everyday blood testing. And that's not counting COVID. We are a medium-sized lab, so we're bringing in a large amount. So the prices that we get on our overall consumables and reagents are fantastic. But with that right now, we're struggling to, of course, just make sure that we have enough. Not struggling, but, it would be difficult for us to give up any supply that we have for someone else, just to be honest.
Great, thanks, Ryan. Mike, thanks for those questions. Any other questions?
Brent, I wanted everybody to know that in the chat box, if people click on the chat button at the bottom of their screen, Ryan Nibert's contact detail is there, his email address and his cell phone number. And he does answer the phone unless he's on a call, but he'll call you right back. I've already had people tell me, wow, he called me back really fast. So, there you go.
Ryan, we appreciate you being here. Appreciate you sharing that information. And looking forward to seeing you as a sponsor at our fall conference. Again, a little plug here for that. So Janelle's got your contact information. So expect to hear from us. Okay, let's go ahead and I think we may have another minute or two here while we're all together. Anything out there that anybody's struggling with, any pain points that you're looking for the rest of your peers and even the laboratory leaders and professionals that are on here, anything any topic that you want to throw out there to the group, anything you need help with?